Technology is praised and blamed for a lot of things in our lives, but now it's literally become a pain in our necks. In a special report, I take a look at how staring at our devices for too long can possibly change the shape of our spine.
I get that they're all like gamers and techers and that type of thing, but I think there's a whole generation of kids that we're now bringing up that are going to have these issues.
The issues Jenifer Berry, a Cumberland County mom, is talking about is what's being referred to as TechNeck. Her 11-year-old son Landon was diagnosed with it earlier this year, most likely caused from spending time looking down at his Xbox and his phone.
Most of my time, because there's like how you can see on phones, like you could see your screen time. Most of it, like per day, it's like 2 hours.
But the diagnosis of TechNeck didn't come from the pediatrician because he couldn't find a cause of Landon's migraines and vomiting.
We had him at the pediatrician a few times right after the new year, and every time the pediatrician was like, oh, you know, I don't see anything, maybe it's just viral. We had blood work done and everything was coming back normal. So I was kind of grasping at straws.
Eventually, Landon would end up at Hershey Family Chiropractic and Dr. Jenifer Epstein.
TechNeck, I think, is more of a recent terminology for a problem that's actually existed for a while. But basically, you know, chiropractors, osteopaths, physical therapists, we're taking a look at the structure of the neck, and what we're actually seeing is people's necks are facing the opposite direction.
And here's what that looks like. This is Landon's x-ray and why Dr. Jen diagnosed him with TechNeck. It's called TechNeck because of keeping our heads in a downward position for too long, you know, looking at the keyboard, the computers, on the cell phone. But as our drone Skyview21 is showing us, TechNeck isn't just for the stationary. We found a way to keep this position even while on the move. And TechNeck isn't just affecting young people.
So this is our 15-year-olds. This is our 41-year-olds. Okay, and this is a proper cervical curve here.
And it isn't just technology. Jason Dudzik, an orthopedic physical therapist with Geisinger, says he's seeing TechNeck in car crash victims as well as people with certain jobs.
We even see this in electricians who are putting lights up, looking up too much. We then have to have them look down frequently to counteract that sustained posture.
Jason demonstrates some examples of those exercises. Since the pain is caused from a prolonged down or forward position of the head, then the treatment involves stretches and exercises that move your muscles in the opposite direction. And Dudzik says the goal is to restore the normal curvature of the spine, or lordosis.
So if we see an x-ray pop up that where the flattened lordosis, we can't say for sure that's TechNeck. We know that we need to move them in the opposite direction to restore that lordosis if we can.
Dr. Jen recommends the same exercises to treat TechNeck, and after just 6 visits to the chiropractor, Landon's vomiting and migraines went away, something mom shared with the pediatrician when they called to check up.
And I felt kind of silly, like saying, oh, well, you know, he's doing much better. We're taking him to a chiropractor. And he was kind of surprised, I think, to hear that, but he was like, you know, well, if it's working and, you know, he hasn't had the migraines and he's no longer vomiting, he's like, then if that's what's helping, so, you know, keep it up.
If the exercises had not worked for Landon, or if he had pain below the elbow, then Dr. Jen would have referred him to an osteopathic doctor. Fortunately, the exercises and visits to Dr. Jen did the trick for Landon, and he will continue to do the exercises at home.
And you could feel right there where like it pushes and like how it's pulling right there.
He will also continue to be a kid and play on his Xbox and talk on his cell phone. And Dr. Jen says she wouldn't have it any other way for Landon or any of her patients.
Because I want you to move. I want you to play with the kids, the grandkids. I want you to experience life and to move. It's just about taking responsibility over your health care.
And you can find this full report on TechNeck on our website. You can also learn what celebrity Dr. Jen noticed and thinks may have TechNeck on CBS21.com.